Alright, this is Dr. Tushar Mehta. I'm an orthopedic surgeon and your faculty of orthopedics. Well, today this is a very important video I want all of you to focus upon. I'm sure on your screen you can see right now fracture patella. The problem with fracture patella is that there are two fragments, the proximal and the distal. Proximal is pulled up by quadriceps tendon, the distal is pulled down by patella tendon. So how do we operate a completely displaced fracture of patella is by this surgery. Just take a look. So what you do is you first of all examine the two poles, then you take a fracture reduction clamp, you bring the two fragments together, you hold them with a fracture reduction clamp. Now you take a K-wire on the drill machine, you insert one K-wire from one side, you insert another K-wire from another side. Now this is the metallic wire, which is the tension band wire, which is a stainless steel wire. You have to pass it under the quadriceps tendon onto the superior pole. You have to pass it under the patellar tendon on the inferior pole, and then you have to make a figure of 8. I'm sure on your screen right now you can see how a figure of 8 is made between them. Then you take a plier and you try to intertwine them together, because the distraction which was created earlier now will be converted into compressive forces. Once you do all of it, cut the K wires, bury the ends of the wire, check the final fixation, and you can see that it is done. I wish you all the best. Stay tuned for more videos like this.